Hello, my name is Wreath, Chief Nursing Officer for England. Welcome and thank you for joining us today on the eve of the 3rd anniversary of when the World Health Organization confirmed a global COVID-19 pandemic. Today, we come together to honour and reflect on the service of all health and care staff during this pandemic. This year marks the 75th anniversary of the NHS, and today we also make time to honour and recognise our health and care staff for their incredible individual contribution to the NHS over the last 75 years. My thanks go to NHS Charities Together, which represents a network of NHS charities based in every NHS trust and health board across the UK, for arranging this moment of reflection. As we reflect, it is an opportunity to acknowledge the impact the pandemic has had on our lives and communities, and to remember those we have lost. The last 3 years have been extremely challenging for colleagues across health and social care, as they sadly have been for so many across the nation. I am so grateful for and proud of the role that all nursing, midwifery and other healthcare staff have played. My thoughts are with every person who lost someone in the pandemic, and with all those who it changed profoundly. While I've always known how remarkable our health and care professionals are, the pandemic has shone an even brighter light on their extraordinary work. I know the pandemic has had a lasting impact on our professions and others. It remains a challenging time, but support and solidarity from our colleagues can give us all strength and find. I personally have never been prouder to be a nurse and to be part of the incredible work that you do. So, today is about remembering those who lost their lives during COVID-19 and honouring the service and huge contribution of health and care staff during the pandemic and over the last 75 years. It is also a chance to pay tribute to what it takes to be a healthcare worker. Thank you all for being here today, and thank you for all you do.
As we walk in fields of gold. just beautiful. I have to confess I was a little biased when we started planning our service, because when that was suggested, it is one of my most favourite pieces of music. So thank you. I'm now not fit to lead the service because I'm so, but that's going to be okay, isn't it? Because we bring our tears of sadness and our tears of joy. And thank you for making that connection for us. Bless you. I'd like to add my welcome to Wreath's to all of you joining here today at the beautiful National Memorial Arboretum and online. On the eve of the 3 years since the pandemic began, and in the 75th year of our wonderful National Health Service. Health and care staff are the beating heart of our healthcare system and have been so throughout the 75-year history of the NHS. Today we remember the service and the sacrifice of those staff who have lost their lives in the pandemic and who have given their lives in the service throughout the history of the NHS. We are also very, very mindful of the ongoing pressures our staff, patients and their families continue to feel. Today, they need even more than ever for us to say thank you and to please stand with us in supporting you. It's fitting that we're here and we now come and just begin to prepare ourselves for a moment's quiet in a moment. But we're fitting that we're here at the Arboretum, a place dedicated to remember who have given so much in the service to our nation. Sadly, across the world as we speak today, people continue to face unprecedented challenge and devastating loss. They too are very much in our hearts and minds and thoughts today. And we're joined today by NHS and social care staff from across the United Kingdom, including GPs, nurses, midwives, ambulance staff, mental health staff, and those providing social care and support in the community, and also by patient representatives. We're also thankful for those joining us online today. We're here today to thank and honour our health and social care staff for their sacrifice, commitment and courage in the face of adversity, and to say we won't ever forget what you have done for us. In a moment, a bell will signal the beginning of a minute's silence, which will conclude by a performance from Alex.
you still love me somehow. I have to believe that life has meaning somehow. That I am useful here sometimes. That I make small differences somewhere. I have to believe that you still exist somewhere. That you still watch me sometimes. That you still love me somehow. I have to believe that life has meaning somehow. That I am useful here sometimes. That I make small differences somewhere. I have to believe that I need to stay here for some time. That all this teaches me something, so that I can meet you again. Somewhere.
Alex, thank you for that beautiful piece of music. It is so difficult to try and find meaning in all of our multifaceted aspects of loss that we've experienced. And thank you for coming and bringing that for us today. Thank you. The themes of our service today are loss, togetherness and thanksgiving for 75 years of care. We're also here to honour what it takes. What it takes to be a health and social care worker. The dedication, the commitment, the courage, the care, the sacrifices, especially in these challenging times. We're here to honour and reflect on the tragic loss of friends and families and colleagues. We're also here to acknowledge the losses and challenges and mental health pressures experienced by health, care and social care staff who are serving us in this unique moment in history. These are difficult days. We are also here to give thanks and celebrate the togetherness, the solidarity amongst health and social care colleagues and the support that they have given to each other and for us. The way staff have cared for each other during these difficult times and cared for others. Their resourcefulness, resilience and commitment has been an inspiration to us, and we hugely value the cost that has been given as they have served us so faithfully. That cost and loss has been felt on so many levels. Healthcare staff across the last 75 years have been driven by their commitment to care for others before themselves. And in these challenging times, they have sacrificed their mental and physical health. Many staff have very sadly paid the ultimate sacrifice with their lives. In introducing all of our wonderful speakers and music today, to bring that inspiring and reassuring comfort, I will be led with Mobeen and Sham, co-chaplains at Birmingham Women's and Children's Hospital Multi-Faith and Belief Team, and from David, a chaplain at University Hospitals Derby and Burton NHS Trust, all of whom have been, in COVID and before, involved in supporting struggling and bereaved families in the NHS.
First, we will hear a poem by Kate Fox Robinson, These Walls Are Witness. Then a testimonial from Karen Bonner, Chief Nurse for Buckinghamshire Health Trust, before Alex sings for us again. Our poems will be read by Rachel Carter, Director of Midwifery, Deputy Chief Nurse, Birmingham Women's and Children's NHS Foundation Trust. Johnny Shah, Head of Trust Charity at Sandwell and West Birmingham NHS Trust. And Heather Petts, Associate Director of Nursing, Birmingham Women's and Children's NHS Foundation Trust.
Just along the way, these walls watch intently as ordinary, fragile lives are pushed to the limits by professions which once made their hearts sing, now just trying to make ends meet. What, with so much dependent on their every move, these walls are witness to slumped shoulders over half-drunk cups of tea, heads in hands lifted briefly only by kisses blown through interior windows from fellow workers. Passing the baton, shift to shift in an endless cycle of extraordinary, intense care. These dependable walls witness to the flow of movement, of repeated footfall, the rise and fall of imperceptible movements hearts try to hold inside.
Just along the way, these walls, though still full of photos, are witness to a new found emptiness within echoes of memories, beds that no one is coming home to, hands left unheld, the soft heads to plant kisses upon, gone now, the space silent, full only of absences. These walls expand around loneliness that will not be contained.
Just along the way, these walls are thick with grief. Sorrow rolls down the pale yellow paint. Pain reverberates through every single streak. These walls are saturated, breaking open from the inside out. These walls hold the horrors of the world, witness to the darkness, listener to the howling, wrenching cries, hearing the most devastating things in the world. And the most beautiful, love that is poured out in words, in tears, in kisses on cold foreheads, in dreams lying shattered, shards of glass under tender feet. They tread softly here, take shaky, sweaty hands, lead them where they do not want to go. And as the mourners leave, these walls feel exhausted faces pressed against the coolness of their paint, trying to absorb their distress, heads resting briefly, before rising again to meet other lives waiting to be walked inside these walls.
Good morning. Hello, my name is Karen Bonner. I was really lucky. I knew really early on what I wanted to do with my life. I would become a nurse. And today, my career has far superseded my childhood aspirations, with over 25 years of experience behind me. These experiences, both positive and negative, have shaped me. And as a black senior nurse, I recognise the struggle that people of difference have in their leadership journey. On the 30th of March 2020, I began as chief nurse at Buckinghamshire Healthcare NHS Trust. At the time, I became one of 10 black, Asian or ethnic nurses working at executive level within the NHS. But I didn't know I was going to start my job at the beginning of a global pandemic. Nothing could quite prepare me or my colleagues for what we were about to face. Working in this profession comes with great privilege, but great responsibility. The demand on nurses and midwives is extraordinary, and as caregivers, we spend our time putting our patients first. The pandemic brought an increased risk to the public, but to healthcare workers alike, and many nurses and midwives didn't sign up to put their lives at risk in the name of the duty, but that's what they did. It was mentally demanding, it was physically demanding, working in the most challenging circumstances. I experienced a roller coaster of emotions, both highs and lows. COVID-19 shone the light on the health inequalities, with disproportionate impact on black and Asian people. 10 weeks into my role, the worst imaginable thing happened. I lost one of my colleagues, a healthcare support worker, to COVID-19. He was being looked after in our intensive care unit by his colleagues. His name was Jean Ture, and we felt that loss throughout the organisation as it sent shockwaves through our teams as we realised this virus had no boundaries. I too experienced a personal loss. A friend of mine died, he was 47, on the 7th of May 2020. I was heartbroken. We all were. Every day I'm saddened by the loss of life, and I'm reminded every day of the pain that every one of us have experienced. This heartbreak is felt so deeply by all of us during the pandemic, and it's a pain that we will never, ever forget. The responsibility for my team weighed really heavily, but it was standing shoulder to shoulder with my colleagues where we found our strengths. The COVID-19 pandemic brought out the best in health and social care staff. We all worked together, common purpose, going above and beyond. Individuals were outstanding in their practice, ready to serve as we fought off this unknown enemy. Today and every day, I am grateful for every one of my colleagues, both past and present, and the compassion they give. And I want to say thank you to all the courageous, tenacious, kind people that make the NHS what it is. Whatever we face, we can take pride in our strength in tackling every challenge as one.
There, I do not sleep, I am 1,000 the softly falling snow. I am the gentle showers of rain. I am the fields of ripening grain. I am in the morning hush. I am in the graceful rush of far-off birds in circling flight. I am the starshine of the night. I am in every flower that blooms. I am in still and empty rooms. I am the child that yearns to sing. I am in each loveling thing. Do not stand at my grave and weep. I am not there. I did not die.
Thank you, Alex, for that moving performance. Before the laying of our wreaths, we will hear further personal experience of the effects of caring during COVID-19, written by Karina Garam, a paramedic from West Midlands Ambulance Service, and today read by Sarah Lawson.
I used to be an auxiliary nurse at Queen Elizabeth Hospital, Birmingham. One night shift after a very long, tough shift, I looked out from a high-rise window, saw a yellow box in the distance, lights flashing, driving through the streets. It was in that moment that I knew my true calling was to become a paramedic. We are the first port of call in life-altering moments. At the core of our hearts and job is the passion for helping people. We provide comfort on people's worst days, but also on their best days, delivering babies, bringing life into the world. It is a privilege to do it all. I began my journey in March 2020, holding a lot of personal grief. I had just lost my nan in February, and then lockdown began. None of us knew what we were facing. We were walking into the unknown. For the first time, our jobs felt scary. We could catch the virus ourselves or pass it on to our loved ones. But we carried on. We had to. My mum was shielding, and I had a young family. I was so afraid of bringing the virus home. I remember walking through the door to my children, having quickly say, "Don't touch me, I have to change my clothes, clean everything," before we could cautiously be near each other. Many of the restrictions we had to use were heartbreaking. I'll never forget caring for a poorly baby. I could only allow Mum in the ambulance. I had to almost close the door on the baby's dad, thinking, this is his baby too. What happens next? Seeing the mum facing such a terrifying moment alone was gut-wrenching. Equally, we were called to a son who had dialed 999 for his elderly mum. She had COVID and was really unwell. We knew she probably wouldn't make it. I had to say to him, "Do you want to say goodbye?" And then we closed the ambulance doors, and that was almost the last time that he saw her alive. It was devastating. I don't think I could have done it without my colleagues. It's hard to describe the relationships between ambulance staff. Through the dark times, we'd held each other up. Sometimes just a look was enough. We all knew we could have the worst job ever, but together we would get through it. We aren't just a crew, we are each other's support. But it's not just each other, we support our patients too. Sometimes we're like swans, calm on the surface, but paddling furiously underneath. Our stability and resilience means we can be the rock they need in moments of turmoil. Our warmth reassures them that they're going to be looked after. I feel truly blessed to do my job, blessed to be part of this team and be there for every patient who calls on us. Thank you.
Thank you, Sarah, for reading Karina's testimonial. It shared so poignantly and captured many of our experiences during the past 3 years. 12 wreaths will now be laid by staff representing different caring professions, patients, those disproportionately affected by COVID, devolved nations, volunteers, and to reflect on global loss. During this time, the Lewisham and Greenwich NHS Choir will sing again.
As we have sought to honour the many types of losses and sacrifices made by so many during the past 3 years, it is also important for us to acknowledge the support and solidarity staff have generously offered each other. We will now hear from Max Usman, Community Mental Health Nurse Practitioner at Lancashire and South Cumbria Foundation Trust.
Good morning, everybody. My name is Maxwell Usman, and I'm especially very honoured to be here today. And I'm on my 51st year as a nurse in the NHS, and I stand in front of you as the proudest nurse on earth. When I was age 19, I came to England from Mauritius. I do consider myself as one of those Windrush generation of nurses of the 70s, but I didn't come over the Windrush boat. I came by an aeroplane. And it was a culture shock when I came here. I had to adapt to the food, environment, and the culture. My English was very poor at the point then. And when I began the career as well, I didn't have much knowledge about the body itself. I knew where my heart was, that was about it. And now, what it meant to be a nurse, I didn't have a clue. I remember my ward sister said to me, "Mr. Usman, you'll never make a nurse." And that does resonate with me to this day, because I was always running like a headless chicken around the ward, not knowing what to do, be very frightened. And again, arriving here, you know, I didn't have no confidence at all to challenge different views and perception. I used to run out of the office when the phone rang because I couldn't really take all these blood samples that they were giving me the results of. And so I just had to go and hide in the sluice and clean bedpans most of the time. And that's where we spent most of our days, cleaning beds and, you know, toilets in those days. And I was warned that you're going to go to England and do those jobs, but I did do it. And the proudest moment was in my life was when I did qualify as a state-registered nurse, and not many of us did that. I was one of the few who was supposed to get the RMN. Most of my colleagues got the SEN, which was the 2 years course, but I was given the 3 year, we was kind of a little bit above the SEN level. So, and everybody said to me, "How come you got to do the SRN? We all did SEN." But nevertheless, I do remember being that proud nurse. I got the ticket now, I thought, and I was really confident to wear my uniform. I did wear it with really pride. I remember having these blue epaulets and white tunic, and kind of walking down the ward like a peacock, you know, chest out and walking down. Look at me, I've arrived. And after that, I did become quite inquisitive, and I was hungry for knowledge. I didn't have much at the time, and I had to overcome a lot of obstacles to flourish and shine. And eventually, I became a deputy director of nursing, mental health nursing, that is. And nowadays, I work as a nurse in Lancashire and South Cumbria NHS Trust. I get to know and connect with my patients, and they connect with me. We have beautiful interaction daily, and that's what, you know, giving me steps in my, you know, when I wake up. I'm looking forward to that to this day. For me, care comes from the heart. It's about being holistic, giving a bit of myself. I always self-disclose when I work, and people say, you know, I can go for a pint with you, and things like that. You're a cool guy. And I like to empower my patients, really, because my patients are my equal, and they're really my ally. And it's about them, and it's not about them and us. We talk about, but there's only one of us. We're all part of that humanity, of oneness. And really, nurses, they get to know their patient the way no one else does. nursing is still really undervalued. I didn't want to be a nurse when I started my journey. I wanted to be a doctor because we put more value to being a doctor. And everybody, when I start my conversation, I'm Max, I'm a nurse. And it's usually down the line, it says, yes, doctor. And I say, I'm not a doctor. I know what nursing is about. I'm the proudest nurse, as I say. So I try to remember to people, because in their head, I can't be a nurse. My granddaughter came to me, she's 5, and said, Granddad, you can't be a doctor. You can't be a nurse. I said, why not, Ivy? She said, you're a man. So eventually she came back to me and said, yes, Granddad, you can be a doctor, you can be a nurse, and I can be a doctor. That was quite a changing moment of stereotype and attitude. And that's, again, the proudest moment of my life. I've said that, you know, we need to write a book. There's a book about my dad is a nurse, but I've said to the people about doing that, I want to say my granddad is a nurse, because I'm a granddad now. So I think I need to change that perception of who we are and what we can do. Now, again, when the, you know, as I said, that undervalue, I want to bridge that gender gap. Well, I know it's very female-orientated, but I'm a nurse, I'm a male nurse, I'm a brown nurse. But we are good nurses, just as the female nurses. Why can't I have more of us? So I do a little bit of that to promote that diversity of nursing as well. You've got chief nurse, you've got the roof-mate, who's the top of our profession. We're very proud. I've had a moment with her a few minutes ago, and she told me to stand between my feet apart, which is quite good. That's what I'm doing. So I've learned something already. You know, during that pandemic, we had a real kind of, we carried a big load. There was guilt and anger. We were all in it together, you know. I had to work from home for a number of months to protect myself from the virus. And with the virtual work we did, we couldn't connect with our patients and colleagues. I found myself feeling really lonely, detached, and isolated, and it felt really hard. But it created a big internal struggle for me. I couldn't stop thinking about the staff in the ITU wards who would be dealing with so much death. I go to bed thinking about that. I wake up thinking about that. The moral injury was palpable, and it was really hurting me. But I had to be there. I had to be with my colleagues. However, for the NHS hub, I found comfort, and there I started, you know, our well-being became a priority, which we used, and I think that was a kind of, because before that, well-being was just said, well-being of staff, but this, at that moment, we needed that, and we felt that was there for us, which was very helpful for me. In the pandemic, I was able to work continuously for 2 years without sickness. I was a lucky one because I didn't feel sick, you know, and I'm still going now, and I've got more to give. People ask me, why do I stay working for 51 years? I'm 70, I was 70 last Saturday, but nursing is who I am. This is what drives me. I find purpose in work. I enjoy my work. And to be honest, I do have Friday feelings Monday mornings. Not many people can say that. Along the way, I've learned the impact we can all have on others. I continue to learn and improve daily. I'm going to revalidate in December. Our compassion really can do, our compassion can and does change people's lives. And I do believe in that. So to my patients and colleagues, I say thank you for all you do. We must inspire each other to keep going, because it's our solidarity that gives me so much hope for the future. Thank you.
Thank you very much, Max, for that inspiration down edges. We now have a special commissioned poem for today by social care chaplain David Buck. If there is one thing that healthcare professionals represent, then that is hope. Hope in times of pain and hardship. hope through acts of kindness, the way they care and heal. We pay tribute and honor those health and care staff who continue to embody hope through what they do. This is read by Adam Aston, a paramedic at West Midlands Ambulance Service. Thank you.
Hope by David Buck. Something compels me, makes me say yes. Yes to purpose, to being. Yes to life. And where there is life, they say, there is hope. Despite all, there is life here. Life in doing, listening, caring, alongside, with and in knowing good will happen because it can. And like a thing of beauty, it is a captivating thing, this hope, that compels me, makes me say yes.
Thank you, Adam. We will now hear from Heidi Thomas, OBE, the writer and creator of Call the Midwife and the screenwriter of the forthcoming Hallelujah, who will share her specially written dedication to NHS staff in its 75th anniversary year.
Hello, my name is Heidi, and I am not a nurse, a doctor, or a midwife. I'm a screenwriter, and I write medical dramas. The blood I work with is fake blood, and at my place of work, when we say cut, we aren't referring to a wound or an incision, but simply telling the cameras to stop rolling. What we do is make-believe, while the NHS deals with life's deepest realities. Today, I stand here with you, and I am completely humbled. But one way or another, whether we work for it or not, we all represent the National Health Service. We literally carry it in our bones. It received us at birth, it vaccinated us, provided vitamins. It has been there for our playground falls and our traffic accidents, our appendectomies and our cancers. It will be there when we are old. But if some of us take from the system all our lives, others give, regardless of the cost. The dedication of the NHS workers touches millions of us. If it feels as though that goes unacknowledged, I, as one member of one ordinary family, would like to say this. To the registrar, summoned from his bed at 4 a.m. to perform the 7-hour operation that saved my life, I will not forget you. To the radiographers who treated my confused 99-year-old grandmother for cancer whilst holding her hand and calling her by her name, I will not forget you. To the grey-haired nurse who calmed my terrified little boy by asking what he was most afraid of, listening to the answer and reassuring him, I will not forget you. And to the paramedics who spent 2 hours stabilising my mother so that she could make her final journey to hospital in an ambulance, I will not forget you. One of you even kissed her on the cheek before you parted company in recess, and I will remember that until the day I die. But what happens to the people whose work is other people's lives? Who cares for them, and how do they grieve? Remembrance is more than not forgetting. It is a commitment to gratitude an active, ongoing respect for the workers who were there and will be there at our frailest moments and in our darkest hours. There are nurses in my family, and during COVID, I saw the wheels the PPE left on their lovely faces. I saw their exhaustion, their determination, their desire to do what good they could. And I still see all of those qualities in action now as the world picks up the pieces, as the NHS fights on. The National Health Service is the greatest idea this country ever had, and the finest story it has ever told about itself. But it has been written not in words, but by the actions of its workers. Every shift, every handover, every hand held, the story continues, because it must. And it is a masterpiece. I bow before it. The people should bow before it. The powers that be should bow before it and give thanks to everyone who makes it possible.
Heidi, thank you for such a personal and professional affirmation of all that we seek to do. Thank you very, very much. And so before our wonderful choir sing us out and remind us of what we take forward, we come and bring together all that has been shared today. As we have gone on that journey of reflecting on all the different types of loss that we've experienced in the last 3 years and in the last 75 years of the NHS, of all those different ways in which we have suffered, we've come and held that together with the hope, with the gratitude, with the thanksgiving and the togetherness that sustains us in going forward. And so thank you to all those who have helped put today together and contributed. Thank you very much. Back right, is it all right? Okay, I'm sorry. My hope, our hope together is that you have found some heart ease, in that you have been acknowledged in all that you have given, in all that it takes to do the job that you do. We hope that we have done justice to acknowledge the current pressures and the losses that you and others have faced. You are busier than ever, yet you continue to put patients before yourselves. You are more tired than ever, but you keep going despite the exhaustion that you feel. We promise you we will not forget your commitment and sacrifices that you and your colleagues have made over the last 75 years and continue to make every day. Today we have heard of the great support of colleagues that we give each other, and celebrating that togetherness, the mutuality, the support and strength that we gain from colleagues, the precious moments of friendship and the hope that can stem from that. We build solidarity together as we bring our strengths and weaknesses as one. And we can be confident that as we go forward, we will continue to affirm and sustain social and healthcare staff in this ongoing multifaceted losses and support. That support from those who care, who are thankful, from a grateful public, for us, even in our darkest moments, when we feel that all that we have done may have not been seen, acknowledged or forgotten. We take forward this. We have not been forgotten. We will not be forgotten. Others will not forget. And we will celebrate all that you stand for. Thank you. Thank you for being there for all of us.